All right, folks, welcome back to the channel. Today, we're going to be talking about a topic that hits close to home for anyone in healthcare, especially nurses. If you're in the profession or know someone who is, you need to hear this. We're talking about the impact of COVID-19 on nurse alcohol consumption. Spoiler alert, it's a lot worse than we expected. So let's break it down. The study we're discussing today looks at how COVID-19 affected alcohol consumption among nurses in Australia. Now, if you know anything about nursing, you know that it's already a high-stress profession. Long shifts, understaffed hospitals, and the constant pressure of caring for people who are seriously ill. And then the pandemic came, pushing nurses to their breaking points. But here's the kicker. Many nurses turned to alcoholism as a coping mechanism. And this study proves just how big of a problem it's become. So let's get into it. The researchers interviewed 42 nurses from across Australia, including those working in hospitals, community health centers, and primary care settings. They found that a huge number of nurses reported increasing their alcohol consumption during the pandemic. A lot of them said they turned to alcohol to cope with the overwhelming stress of their jobs during COVID-19. And it wasn't just about needing a drink after a tough day. Alcohol became like a reward system for them. Nurses would work grueling shifts, skip breaks, and endure extended overtime. And at the end of it all, alcohol was their way to say, I survived today. Think of it like a coping tool for burnout and exhaustion. Well, as you can probably guess, drinking to cope isn't exactly a healthy solution. The study links this increased alcohol consumption to potential long-term issues, burnout, absenteeism, and even more nurses leaving the profession. And that's a big deal, folks. The nursing workforce is already stretched thin, and if this trend continues, it could cause even more instability in the healthcare system. But here's the kicker. It's not just about the nurses who are turning to alcohol. It's about the fact that the healthcare system hasn't been giving them the support they need. With all the stress and lack of resources, many nurses feel like they have no other way to unwind. And what's the healthcare system doing about it? Well, according to the study, not much. First, let's be clear. We need to talk about this problem openly. It's not just about working too hard or toughing it out. It's about the systemic issues that drive nurses to these coping mechanisms. The healthcare system needs to prioritize mental health just as much as physical health. Nurses can't keep pushing themselves to the limit and expecting to stay healthy without support. Second, we need more structured mental health resources for nurses. Stress management, counseling, and even social support networks need to be in place. Right now, we're just leaving a time when nurses were trying to cope with the biggest health crisis of our entire lifetime, and many of them felt like they were doing it all on their own. And lastly, we need to get real about alcohol consumption in the healthcare profession. This is a serious issue, and ignoring it isn't going to make it go away. Hospitals and healthcare systems need to create safe spaces where nurses can openly talk about their struggles without fear of judgment or backlash. Because let's face it, if these nurses are the ones taking care of us, they deserve to be cared for too. COVID-19 pushed nurses to the brink, and alcohol consumption was just one of the ways they're coping. If we want to keep the best healthcare professionals in the field and provide the best patient care, we need to start taking their mental health seriously. That means offering support, addressing the systemic issues, and making sure that these heroes aren't left to deal with the burnout and alcohol abuse on their own.